Well, hello, Pam.
Mac, my friend.
How are you doing, dear?
It's Friday. I am feeling fabulous, ready for the weekend. Yourself?
Well, I am ready for the weekend, ready for the holidays upcoming. Got a big old brisket to barbecue for the family, so
Ooh,
I'm
yum.
good to go. Good to go. Okay, so I got into this kind of dentistry that you're in a little bit late. I was only 60 years old when I got into it. It opened my eyes to not only the pain patient, but what you could do for them and all the unbelievable things that go along with the pain patient. And to not be a pain patient, you got to go back to being a kid when things are developing. Because if they don't develop right, everything's going to be compressed. And if everything is compressed, then you can't breathe correctly. And it wasn't but a couple of years ago that I ran across a video on a kid that had ADHD, and it was a compression problem. It was a breathing problem. It was a nighttime problem. And this is something that you have spent a lot of time in your career studying and helping parents with their children on ADHD. I know nothing about it other than it's common sense that a child has to breathe at night while they're developing. Would you please elaborate on this unbelievable finding?
I'm going to start this with a patient story again because I see so many people. And a couple of weeks ago, this 9-year-old boy comes into my office. Uh, a month prior to that, I had done a class for Northern Virginia Dental Hygiene Society to teach a group of hygienists about how to quickly and properly screen for obstructive sleep apnea and sleep disorder breathing. And, as every time you have a class or a presentation, you have all the people come afterwards to ask you questions. Well, this lady, this hygienist didn't come up, but she shows up in my practice about a month later. Her son is about 10 years old, and I get choked up every time I talk about this because it's so difficult. But her son, he's like the sweetest little boy, and he's telling us that he's scared to sleep at night. Okay, he's scared to go to sleep, and his parents are like trying to figure out what's wrong with him. And we had already done a 3D scan of him to see what his cranial facial structures look like, see what his nose, his adenoids, turbinates look like. And he has giant adenoids, giant turbinates, giant tonsils. And, he's such a well-spoken and, to me, calm boy. He's not fidgeting like they usually do. But I'm like, why are you scared to go to sleep? And he's like, I'm worried I won't be able to breathe and I'm going to die. Right? This mom has taken this boy to like 5 or 6 doctors, the pediatrician, 2 ENTs, a neurologist. They had him do an MRI. Could you imagine being that boy in that machine to see if he has a tumor because he's being told that there's a tumor when there's blatant airway issues. And as he's telling the story, his mom is just sitting in the room trying to hide her quiet tears. And, 20 years doing this, it's never easy to listen to these stories. Each one are just so painful because you're like, why can't people just see the blatant problems? When kids cannot breathe through their nose, you know, they can't sleep well at night, which causes a myriad of issues. Um, when we breathe through our nose, it allows something called nitric oxide to be created in the nasal pharynx, which is the nasal cavity. That nitric oxide, for our listeners, you can Google it and see the impact and relevance it has to the body. But an overall scope, it affects your focus, your cognitive ability, your mental acuity. It affects your cardiovascular health. it affects your overall well-being. Imagine if you can't sleep well and you don't get proper airway exchange or nitric oxide exchange. These kids, in my opinion, and other leaders in our profession, to me, they're almost brain damaged. These mouth breathing children are almost brain damaged. And when they can't breathe through their nose and they mouth breathe, not only is this issue with nitric oxide is occurring, but they also manifest all kinds of nighttime issues. So listeners, kids that have children that have prolonged bedwetting issues, they're 3, 4, 5 years old, they're still bedwetting. Children that have night terrors. Sometimes it's more subtle, like kids that sweat or they're restless sleeper. We all think it's cute when our kids are all over the bed. That's not normal. If they're open mouth breathing and snoring, as you guys know from previous podcasts, none of that's normal. Now, just because somebody has an open mouth airway issue doesn't mean that they won't thrive. Some people can be very, they'll persevere, they'll push through. I always tell the kids in my practice, you look at Michael Phelps. Michael Phelps is, to me, a perfect example. I don't know if he's ever been tested for sleep disorder breathing, but when you look at his face, he has no mid-face. The lower jaw tried to outgrow his face to help him breathe, but he's an Olympian. He's a 2-time, I don't know how many time Olympian winner, right?
Yeah.
So he pushed and pushed and pushed and persevered despite his limitations. But if someone saw that man, that athlete, when he was a child and recognized the issues of his like deleterious or negative craniofacial development, like the wrong direction he's going, and they nudged him to develop better, I tell the kids in my practice, I go, man, maybe he could actually speak to the sea creatures and the water creatures. He could be like Aquaman, not just an Olympian. Who knows what his potential could have really been? And I don't share this with the kids, but I share it with the parents. It's like, do you know what Michael Phelps does now?
No.
He is the spokesperson for depression, right?
Yeah.
So you don't know what people are suffering from. You don't know what they're pushing through, but it does start with the children. And ADHD is one of the most commonly misdiagnosed conditions. I believe these kids are being overly diagnosed with this condition. I feel like they are being medicated all the time. The kids in my practice, when they come through our orthodontic treatment, we don't talk about just straight teeth, which is very hard for people to conceptualize if they just came to us for straight teeth. A lot of our patients come to us because of mouth breathing, ADHD, tongue ties. So some of them know. But when these kids go through our orthodontic program, we talk about what caused the teeth to come in crooked. I want to be the first and last person that treats their orthodontic condition, their craniofacial condition, so that they're not like most of the adults in my practice that are going through braces for the third, fourth time, right? If they know what caused the problem that made their jaws narrow, which manifests in the appearance of crooked teeth, then we're correcting the problem. And I tell them, I'm like, mechanically, I'll move your teeth and make your teeth smile gorgeous, but we're not fixing what caused the problem. And you will regress. Your face will change with time in a negative way. Your teeth will get crooked again, and you will have to have treatment done again. So we talk about getting the tongue up against the palate, breathing through the nose, having a lip seal when we're not talking. And when these kids start doing that and we clean up their noses, the tonsils and adenoids and turbinates are cleaned up and they're breathing through their nose, I can't tell you how many parents come in and say, wow, my kid can read a book. They didn't share that with me. I'm like, what do you mean by that? And then I hear a bigger story later. Or the kids that were on ADHD medications that coming in like somewhat zombies, no longer on ADHD medications and they're thriving. So if we don't get the right type of air to our oxygen to the brain and nitric oxide to our body, these kids are going to suffer. And that video is a very profound video. Finding Connor Deegan. It was a collaborative by the medical doctors and some pediatric dentists, overall sleep doctors that put this conglomerate together. And it's an amazing video. Our listeners, look that up. It's Finding Connor Deegan, I think it's what it's called.
Right. Right. So let's open up. Here's the problem. You're a doctor, you got a DDS, but the MD doctors don't listen to you about opening the throat up and the tonsils and et cetera, et cetera. So if they're not going to diagnose it, and you've got dentists who are on roller skates and they're just doing what insurance pays for, they're not going to diagnose it. So it's going to be the job of the parents to be aware of this and start demanding
Right.
that these issues be looked into. So what would you tell the parents that are listening to this who have children, and because of genetics, if they're listening, probably because they have TMD themselves, well, they have the genetics that their kids may have TMD or breathing issues themselves.
Right.
So what would you tell these parents on what to look for?
If they're younger children, sometimes a sleep study, one out of every 2 sleep studies are usually inaccurate. They give a false negative. So a sleep study is not always the best indicator. I tell the parents coming in to videotape your kids sleeping at night, okay? When they're not on their steroid inhalers, because a lot of them already are, and they're not on medications, antihistamines. Just walk back into their room, because once your kids are not toddlers anymore, we're not checking on them. We're trying to get our own sleep. I get that. I'm a parent too. But go back into their bedroom and take a 3-night study, sporadically, 3-night study of your child sleeping. And look for not just the obvious, which are snoring, but look for the subtleties of, is their head kicked back, like lifted up to open up their airway? Are they open mouth breathing? If you can see their chest constantly like going from a certain rhythm of natural breathing to like belabored breathing, and then sometimes almost like a convulsant and stop, those are things to record and take to the ENT, because at this point, the ear, nose, and throat doctors are the only ones that can still perform the surgery. And we are, we're on their doorstep begging for them to help out with this issue. So I tell the parents, you have to arm yourself and advocate for your kids, and not just acquiesce to, hey, here's some Nasacort, spray that up your nose for the rest of your life, when we know what long-term effects that will have on you.
But these are with children with bedwetting, sleepwalking, night terrors, etc., and mouth breathers, right? And if they have ADHD, so which is not normal.
Right.
So first of all, you start with what's not normal. Well, my child's not sleeping all night long and have all these issues. That's not normal.
Correct.
So that's when you start your investigation, correct?
Correct. It's amazing to me, the hugs and tears that we see and get in our office from parents, that when a child is young, sometimes we use different appliances, one of which is a myo brace, where they sleep with it in their mouth, and it puts the tongue in the right place. And it makes them have to breathe through their nose. Literally, by the next month we see that child, the parents are like, oh my God, I cannot believe that this has been the issue, that they're no longer having night terrors. They're not screaming. They're not having to get up to go to the bathroom or wet their beds. That's almost like instantaneous, almost instantaneous. And then that alone is evidence that, hey, mouth breathing is an issue causing these issues for my child. But how do they convey that to the ENT without it just being anecdotal, right?
So then again, like TMD, this issue belongs to the dental profession.
Yes.
Now, as dentists, we can't diagnose sleep issues, but we can screen for them. And legally, you have to have the backing of an MD to do that. So it puts the poor patients and the kids and the parents in a horrible situation of finding help. So how does someone find help, find a Pam Marsban where they live? Because this is serious.
Now,
It's a
word of
serious,
mouth.
serious.
It is serious. I write articles for a local magazine, trying to get that content out there, get people to come find us. You and I are doing this, but even, I have family members in the pediatric community. They're not being taught this stuff, and aside from that, when you're seeing 30, 40 patients a day,
Right.
I mean,
Exactly.
it's like a mill. You don't have that time. Your heart can be in the best place, but if you don't have the time, you can't see what's right in front of you.
Right.
So,
And so the not getting the oxygen, not getting the sleep, being disturbed all night long, then the after effect could be ADHD, where the child just feels horrible that next day and acts accordingly, I'm assuming.
correct. Yeah, most of these kids, not always, are the ones that are not doing well in school or the class clown because they're antsy and all over the place. Their bodies are either exhausted or on hyperdrive because they're never in that parasympathetic mode. So listeners, like if your child has ADHD, one of the first things I would go back and revisit is, what is a demand? I need you to look at my child's tonsils and adenoids. If you go to the ENT, they might stick a light and look inside the nose. They might put a scope through the nose, which is rather uncomfortable. If you go to a practice like mine that has a CBCT, which is 3D imaging of the head, it's very easy to see that without it being painful or uncomfortable to the child. But that's the first thing I would think about is like, does my child have an airway issue? Just watch them, not just at night, but like when they're gaming or playing or reading, are their lips apart all the time? If their lips are apart all the time, there is an airway issue through the nose. And it's so under the radar because this is extremely common. So we think this is normal, and it's not normal.
So those of you listening and can relate and have family that has the same issues, please let everybody know about this podcast. This is just way too important. This is one of the most important things that we've talked about because I've got grandkids, and for them to have that kind of problem would just devastate me. And then, it's the kids are everything. And like we talked in previous podcasts, unless you get them when they're young,
Right.
you can't bend a tree unless you bend it while it's growing.
Well,
That's just common sense. And so you got the child's the father of man. So we've got to take care of the kids.
I can't I can't remember a time that I've talked to an adult who comes into my practice that before they leave, they're like, I need you to see my child,
Right.
because sometimes we have the thought that we're supposed to look like our parents. And yes, there is genetics, but something you alluded to earlier in this podcast, what if that genetic potential of the face never was fully expressed because that parent had certain allergens they were sensitive to. So they started mouth breathing, and then their child has the same type of sensitivity. But, as a parent, and all the parents that suffer take this so seriously because they know what they've been through and how they feel. So they want more for their kids. And then when they see their children's faces develop better than theirs, oh my God. They're like, why didn't someone see me? One of the girls that works for me, she brought her daughter in because she recognized that she's got the same developmental pattern. And I can kind of talk to them like this, but I told her daughter, I was like, you're going to be even prettier than your mom. You know that. And you're going to be set up better than her.
And I would have to send, I didn't do ortho, I'd have to send my patients to Houston, 100 miles away to get the proper care like that you
Wow.
give. And I always tell the kids, I said, I want you to thank your parents, because parents would be in the office there. I want you to thank your parents because they have given you a gift of a lifetime.
Right.
This is a lifetime altering gift that your loving parents have given you. And
Right.
it is.
My goal is if I get the children young enough that they never need to actually go into braces,
Right.
and that we can get the body functioning correctly with or without appliances, depending on that person, and set them up well for life. Now, what's crazy is like sometimes somebody is developing well, like their tongue is in the right place, the arches are developing great. And then they're later are exposed as they're still developing, like in their teenage years, to like a pet, for example, that they have a sensitivity or allergy to. And then they start mouth breathing. And then that exposure starts to set them off on the wrong path, or when we all had to wear masks because of COVID, that exacerbated the whole mouth breathing situation. So there's different things in our life that can set us off or set us on a new direction that's not great. But if we can get these kids started off right and teach them about what to look for, shoot, we're all trying to live till we're centenarians. I'd love it to be a healthy life that not only do we feel good, but we look good and can eat whatever the heck we want to. Like, that's what I'm talking about, right?
Yeah, there you go. I'm almost there.
That's funny. Well, my goal is 105. 105 is
105.
yeah.
I'll remember that. I'll remember that. I'll look back when you turn 105. How's that?
But that's it. This is about longevity. It's about feeling well. And this podcast is for us to, again, open up, get people to realize you don't just have to settle for medicating your kid with ADHD.
Right.
That there are true neurological conditions that can cause that, but 9 out of 10 times it's an airway issue. So let's look at that.
Well, and to kind of wrap things up, go back to nature. If it looks right, if your face looks right, if it's harmonious, more than likely it's right. If it doesn't look right, there's something that didn't develop correctly. And
Right.
and that's what you've been talking about.
Right on, Mac. All right, friend. Have a
All right,
wonderful
dear.
day. Enjoy
See you
your
later.
brisket. Bye.